In the last 2 years, over 130 people have died of an opioid overdose in Waterloo Region. That's 5 times the number of people who died in car crashes. And 911 first responder calls continue to rise, on average 91 calls per month. In addition, there are thousands of people in our community who are living with addiction each day. Opioids don't discriminate. They kill all genders, rich and poor, educated and uneducated, and everyone in between. One of the biggest problems we face is not just the drugs, but the myths about drug use. Myths lead to stigma, and stigma is one of the biggest barriers for those who need help. You've likely heard these myths. Addiction is a choice. Just as people choose to use drugs, they can choose to stop. The fact is, addiction is an illness and not a choice. Some people even become addicted after having been prescribed an opioid for pain. People simply don't choose to risk everything. Another myth is that addicts are dangerous and disrespectful to property and society as a whole. People who use drugs are our family, neighbors, co-workers, and friends. It can make the situation worse when we don't treat them as part of our community and prevent them from getting the help they need. Another myth is that Waterloo Region isn't doing enough to address this crisis. The reality is, there's a lot happening behind the scenes. Our region is a caring and practical community. It's not always easy to see all the activity that's taking place. Our educators and community members, outreach workers and public health, treatment providers and first responders, and police have come together like few communities have ever seen before. Together, they've formed the Waterloo Region Integrated Drug Strategy. Good drug strategy starts with prevention, including education for parents and caregivers, curriculum support for teachers, and making sure our kids are involved in meaningful activities to prevent drug use altogether or to delay the onset. It all means fewer people start using drugs. We know that our harm reduction programs are working. With things like overdose awareness days, naloxone expansion in the community, and more needle and syringe programs and outreach, harm reduction connects people with experts who care. Recovery and rehabilitation are critical because when people are ready for help, they need the right treatment at the right time. Rapid access addiction clinics use medical care, counseling, and peer support to help people with health issues related to drug use and withdrawal. 2 clinics were opened in 2018, and hundreds of people have accessed them for care. More community treatment spaces are needed, including residential and day treatment, counseling, and support. Recognizing that addiction is not a crime, but an illness is key to us finding smart solutions. Enforcement and justice is an integrated part of the solution. We are working to prevent crime and divert people who struggle with addiction away from jail and into treatment and support services. At the same time, the police are focusing on organized crime, which preys on individuals who suffer with addiction. It took years for this crisis to develop, and it will take years to overcome it. There is still so much work to be done. Your understanding, involvement, and support is an important part of the solution. So reach out and learn more about what's happening in your community, talk to family and friends, and help us succeed.